Dear participants, hello. I would like to welcome you to my presentation, which is part of the project called the Clinical Key for Electrical Stimulation and Physiotherapy and Rehabilitation. So this project is funded by the Erasmus Plus program of the European Union, and the leading university for this project is Pamukkale University. And the partner universities are University of Craiova, Mustafa Kemal University, Tashkent University, Suleiman Demirel University, Šiauliai State University of Applied Sciences, and Burdur Mehmet Akif Ersoy University. Also, partners of this project are Turkish Physiotherapy Association, Order of Physiotherapists in Romania, and Lithuanian Physiotherapy Association and Estonian Association of Physiotherapists. So this presentation is part of Module 2, currents used for electrical stimulation, and today now I'm going to be talking about microcurrent stimulation. So authors of this presentation and chapter are Govidas Gedrimas, which is me, and my colleague Vaida Aleknavičiūtė Ablatskė from Šiauliai University of Applied Sciences, Faculty of Healthcare and Department of Rehabilitation in Šiauliai, Lithuania. So to begin, microcurrent electrical neuromuscular stimulation was developed as a physical therapy modality delivering current in the microamperage range. It has been reported that microcurrent electrical neuromuscular stimulation has several physiological effects, such as pain relief and facilitation of tissue repair, including tendon injuries, skin ulcers, wounds, bed sores, ligament injuries. So this stimulation has quite a wide range of applications, and it can be used in many pain or tissue healing cases. So it is important to mention that MENS is microcurrent electrical neuromuscular stimulation is a physical modality delivering subsensory low amperage and thus mimics the electrical intensity found in living tissue. So in traditional electrical stimulation, we use milliamperes to increase intensity of electrical stimulation, and as the name of this stimulation suggests, microcurrent stimulation. So and we use microamperes for this electrical stimulation intensity. So this intensity cannot be felt by our nervous system. So what does that mean? That this stimulation has no sensory effect for the body, but it has very important and deep effects for the tissues that are affected. So if microcurrents of physiological amperage were delivered into damaged muscle tissues, it could control the altered membrane function by various mechanisms, such as maintenance of intracellular calcium homeostasis and the upregulation of adenosine triphosphate production. So, as I would like to mention also, this type of stimulation, microcurrent stimulation, increases adenosine triphosphate production and quantity in the tissues, while other electrical stimulations, for example, transcutaneous electrical stimulation, reduces adenosine triphosphate production. So that's why it has such a good effect for healing, because it increases production of ATP, and thus the tissues has more energy and resources to heal. So studies show that treatment of muscle damage with microcurrent therapy with low amperage can reduce the severity of muscle pain symptoms. So I should mention that intensity varies between 1 and 999 microamperes. So that's why it's called microcurrent stimulation. So not milliamperes as it is usual for other types of stimulation, but microamperes. So with microcurrent, the patient cannot feel the currents since there is not enough current to stimulate sensory nerve fibers, as I mentioned before. Traditionally, microcurrent electrical neuromuscular stimulation therapy has been used to increase the rate of healing in injured athletes, to treat and manage muscle pain and dysfunction, and to increase the rate of fracture repair. So, this is quite universal treatment methods for many cases. So in pain control, the mechanism of pain control using the microcurrent electrical neuromuscular stimulation therapy device, it can be also called microTENS device, differs from the traditional transcutaneous electrical nerve stimulation using nerve excitation by sensory stimulation. So TENS traditionally uses sensory stimulation, while microcurrent stimulation, as I mentioned before, has no such sensory feeling for tissues or for the body, for our nervous system. One theory of the microcurrent electrical neurostimulation for pain control is it can create or change the constant direct current flow of the neural tissue, which may have some way of biasing the transmission of the painful stimulus. And those painful stimulus decreases or can't reach the central nervous system and be applied as pain control. And MENS may also make the nerve cell membrane more receptive to neurotransmitters that will block transmission. So that's why it also helps to control the pain feeling, to reduce it. Yes. So a current in the range of from 10 up to 500 microamperes was observed to increase ATP production, amino acid transportation, protein synthesis, and waste product removal in tissues, whereas ATP production leveled off between 500 and 1000 microamperes or 1 milliampere, and decreased when the current was above 1000 microamperes or 1 milliampere. So the less amperage we use with microcurrent stimulation, the more ATP production we get in the tissues and damage the tissues. So this is really helpful if we want to increase healing rates of damaged tissues. Usually TENS devices provide up to 60 times higher current levels than that seen to increase ATP production, which may explain why TENS units have not been found to be effective in treatment of delayed onset muscle soreness, also called DOMS. So that's why TENS stimulation decreases ATP production. So the muscle healing and healing rates are slower than with the microcurrent stimulation, which increases ATP production and helps to heal, and the tissues has more resources to heal. So typical microcurrent applications use only low and simple one-channel frequencies such as 0.3, 3, 10, 30, and 300 hertz. While talking about tissue healing, microcurrent electrical neuromuscular stimulation is now being successfully applied to promote healing in a number of situations, including soft tissue healing and treatment of non-union fractures, among others. So, as I mentioned in the introduction, cases list where we can use this stimulation is quite wide. Microcurrent electrical neuromuscular stimulation has been shown to delay the onset of myalgia, improve sympathetic nerve tone, promote wound healing, increase beta endorphin and pain threshold levels, repress bacterial growth, reduce foot muscular fatigue and pain, and increase the blood flow rate. Microcurrent stimulation between 200 and 800 microamperes is a way of supercharging the tissue with ATP. As we talked earlier, it increases it, which will reside there until needed. So this means that much of the research that shows a 200% increase in healing rate while using microcurrent stimulation. So this can be explained as it applies to hundreds of conditions. In a clinical sense, any healing process takes a great deal of ATP and may be accelerated through a means of increasing ATP in a tissue. Microcurrent electrical neuromuscular stimulation accomplishes this by increasing ATP in the tissue by up to 400%. And these ATP molecules can be stored in the tissues and taken when it's needed. When the healing process, for example, starts, then this ATP is used for these processes. And as I mentioned before, other electrical stimulation approaches usually decreases ATP levels, so tissue healing acceleration is not as great as in microcurrent stimulation. So microcurrent stimulation has the advantage of rarely causing muscle contractions and uncomfortable sensations to the skin, and has only a few electrical side effects. Hence, the stimulation is suitable for patients who have limited mobility after surgery. And as mentioned before, the sensation there is no sensation of electrical stimulation in this type of procedure. So that's why it has so few limitations. The basis of the stimulations is the ion channel and cellular communication that stimulates cell activity by normalizing the cell's electrical environment. Furthermore, it activates the differentiation, proliferation, and migration of cells by facilitating the tissue healing and recovery process. So it's wonderful procedure stimulation for increasing tissue healing. One other important part in the rehabilitation process is that the microcurrent stimulation can help to prevent muscle atrophy. For example, microcurrent stimulation might prevent progression of gastrocnemius muscle atrophy and facilitate the generation of muscle cells. So studies show that it can really prevent atrophy in these muscles. Also, microcurrent stimulation helps with the regrowth of atrophied soleus muscle. So studies also show that. So therefore, MENS has the potential to become an effective therapeutic intervention to recovery muscle atrophy induced by chronic immobilization. And if it is possible, this stimulation could be used in the immobilization process as well. So in that case, atrophy processes would be much slower. Then the effectiveness of microcurrent stimulation with two different electric current intensities. So when comparing 15 microamperes and 500 microamperes, it was concluded that current intensity of 50 microamperes was more effective than 500 microamperes in alleviating symptoms and promoting tendon normalization and in chronic tennis elbow. So as I mentioned before, the lower the amperage, in this case microamperage of stimulation, the more ATP production and we get in the tissues, and the more ATP is stored in surrounding tissues of the stimulation. Also, it was confirmed that the regrowth of unloading associated atrophies, atrophied soleus muscle is stimulated by a microcurrent electrical neuromuscular stimulation. And now we can talk about application types. So there are a few types how this stimulation can be performed. One of application types is probe electrodes. So many different devices may have similar probes. Usually, probes are used by healthcare specialists to alleviate pain and increase function. These work better than self-adhesive electrodes because it is possible to place them directly and around the pain area. It is recommended to saturate them with electromedical conduction solution. So it is quite an advantage to have a probe versus self-adhesive electrodes, because electrodes can be placed in various places, and these places can be changed quite fast. And usually manufacturers recommend recommendations vary. Probes are typically applied for approximately 10 seconds per placement. So we use 10 seconds on one point of pain, for example, then we change, and this way we can go, for example, around the knee joint quite well, because we reach many spots around the knee joint, for example. So usually one treatment set is a group of 12 to 20 of these points for 10 seconds for each, and usually a different angle of approach is applied. Other type of application is self-adhesive electrodes. So they are placed within the same guidelines as the probe, so around the painful areas, except for a longer period of time. So if we place electrode there and so we leave it for a certain time, for example, 5 to 10 minutes on this spot, and we treat it with microcurrent stimulation. So for optimum results, electrodes may also need to be moved around the program area. So this is a little bit uncomfortable comparing to probe electrodes. So in comparison, whereas the probes are used for 10 seconds on one side, electrodes should be placed and left for at least 5 to 10 minutes. Accordingly, electrodes are best used for home care. So if patient has access to this. So this is an example of how electrodes can be placed. So around the knee joint, it's quite similar to, for example, TENS stimulation. So we place 2 electrodes on medial side and 2 electrodes on lateral side of the knee, and this knee will be affected by microcurrent stimulation. Also, it is possible to treat contralaterally the right knee pain with contralateral technique. So when we place 2 electrodes on the right knee and 2 electrodes on the left knee. Also, it can be used for back pain. The recommendation is to place electrodes opposite one another. So one electrode is placed next to the spine at the level where the problem is. So it can be at one segment of the spine, and the other on the contralateral side anterolaterally, so from the opposite side. In this way, microcurrent stimulation will go not only 2-dimensionally, but 3-dimensionally deep to the body and surrounding tissues. Transducer gloves also can be used to create a microcurrent stimulation effect. So usually microcurrent instruments are supplied with graphite vinyl gloves. That's how they look. So the therapist places the hands on the affected area, in this case for lower back. So these lightweight gloves have electromicrojacks connected to the dorsal surface and are designed to conduct current and provide sensitive tactile perception. So in this way, we combine two treatment methods, so soft tissue mobilization and microcurrent electrical neuromuscular stimulation. So in this way, they complement each other. So the therapist can perform massage techniques, manipulation techniques, mobilization techniques to reduce pain, and while doing so, there are also microcurrent electrical stimulation affecting the tissues and increasing the effect of those manual techniques. And the other treatment method is wireless microcurrent electrical stimulation. So it's quite new and innovative technology. It is simple, non-invasive, and pain-free methods to transfer current wirelessly to the wound by using oxygen and nitrogen ability to donate electrons. The charged particles create a direct current of a very low intensity with no physical contact to the wound thanks to its spray effect. It offers a radical advantage compared with other currently used electrical stimulation techniques. So it's really an advantage because we can use it for wound healing. For example, if there's open wound, bed wounds, or something similar, and without the fear that there would be an infection of the wound because there is no contact with the stimulation device. So this wireless microcurrent stimulation device works by transferring distantly low intensity electrical current to the patients. The patient has to be part of an electrical circuit, and for this reason has to be connected with the device through a wrist strap wire, usually placed on the patient's intact skin, far away from the wound. For example, if there is a leg ulcer, it's normally to place it on the wrist joint. Distance from the head of the device to any wound should be 12-15 centimeters. So it's an optimal distance from the device to the body. The treatment surface covered is about 400 quadratic centimeters, which can be increased by moving away the head of the device from the wound. But it should be noted that the farther away the device is, the weaker the effect of the stimulation will be. The recommended treatment time is 45 minutes, so it is important that the patient lies comfortably because the wound position relative to the wireless microcurrent stimulation device should remain steady throughout the treatment. So the maximally comfortable position for the patient to lie for 45 minutes. And indications for microcurrent electrical neuromuscular stimulation are, besides those that I mentioned in this presentation, so it is joint pain, soft tissue pain, neuralgia, tendonitis, bursitis, phantom pain syndrome, rheumatoid arthritis, migraine, torticollis, epicondylitis, frozen shoulder, low back pain, intervertebral disc syndrome. Contraindications are conditions with unknown etiology, conditions which demand cardiac pacemakers, areas over cancer lesions or the carotid sinus and the transcerebral area, pregnancy, seizures, pain of central origin, epilepsy, areas over skin and vascular disorder. And these are partners which are participating in this project, and thank you for your time and for watching this presentation.